All non-urgent operations in England will be postponed for at least 3 months to help free up around 30,000 beds. But how well has the health service been preparing for a potential pandemic? We've been looking into claims that for years the government has not heeded warnings about the lack of ventilators and intensive care equipment. Our health and social care correspondent Victoria McDonald reports.
The warnings were there almost from the beginning. Pictures from China showing patients needing intensive care and ventilation. Then we saw what was happening in Italy. Different hospitals, same scenario. The UK couldn't say that it wasn't warned, that more equipment, more staff, more ventilators were going to be needed for COVID-19 patients, a disease that can cause a type of pneumonia.
Tonight, this letter has gone out from NHS England to all trusts saying that they must postpone all routine operations from April the 15th for 3 months, that they must find maximum capacity in critical care and inpatient beds and staff. And they said, prepare for and respond to the anticipated large numbers of COVID-19 patients who will need respiratory support.
But is this all too much of a scramble? Should the health service have been better prepared? Medical staff are reporting that there is not enough protection equipment, including masks and gowns.
We need to know that in the next few days that enough will be supplied. That it may mean they have to start manufacturing it from scratch, but we need to know that is happening so that we're not suddenly falling short of the amount we need.
Even with the NHS flexing up what's known as peak surge capacity, the maximum number of ICU beds is approximately 5,000. Scientific modelling released yesterday by Imperial College London showed that if one person infects 2.4 others, then in the do-nothing scenario, you will need 180,000 ICU beds at the peak. So the new measures, social distancing, home quarantine, they aim to bring that down. But even then, as many as 11,000 beds will still be needed, and that remains well over capacity.
Flu viruses can spread if you don't catch your coughs or sneezes hygienically.
The last epidemic the government was confronted with was the swine flu outbreak in 2009. This pandemic flu report says the potential number of referrals to critical care is likely to exceed bed availability, and that during the peak of a pandemic there may be 10 times as many patients requiring mechanical ventilatory support as the number of beds available. Individual NHS trusts also flagged up the glaring shortage of ventilators. Royal Cornwall Hospital's NHS Trust's pandemic influenza plan, for example, stated the demand, particularly for ventilation, is likely to exceed available resources. It is 2020, the pandemic is here, and it's clear now that there are still not enough ventilators.
We really only have a few weeks to build literally thousands of ventilators that this country will need.
The Intensive Care Society says more could have been done in the past decade. They haven't increased critical care beds despite increased demand. They said equipment could have been kept in storage, and above all, there is a need for more staff. Today, the NHS is running a stress test to see how it will cope. And nobody is in any doubt that the staff will pull out all the stops. But when this is over, the question will still remain, could more have been done earlier?
Victoria McDonald reporting. Now, a short time ago, I spoke again to the former Health Secretary, Jeremy Hunt, who is now chair of the Health Select Committee. I started by asking him if he was satisfied that there will be enough ventilators to tackle the virus.
It was very clear listening to Sir Simon Stevens that they are still very worried they may not have enough ventilators. But the measures that were introduced yesterday do have a chance of reducing the peak pressure on the NHS to within the number of intensive care beds that they think they will have. Now, obviously, we don't know. We don't know how much the public will go along with what's been requested, how much older people will take the advice to cut down on social interactions. We're asking a lot of a big chunk of the population. Now, if people cooperate with that, then we have a chance that the NHS will be able to cope, but it is only a chance.
We've been looking into the whole ventilator issue, and it seems this rather vital equipment, in the event of any great threat to health across the nation, has been in gravely short supply in the Department of Health for a long, long time. Were you aware of it when you were Secretary of State?
I wasn't actually, but we did a lot of pandemic planning, and I think it is true that we all woke up to this very, very late because this virus struck us from nowhere at the beginning of this year. But I think a lot is happening on ventilators, but I think the message is that we can't let up because there's still a possibility that this is going to it's not going to be possible to suppress the virus. The strategy now is to do what they've done in South Korea and Taiwan to try and avoid a kind of Northern Italy style meltdown.
When we spoke to you last week, you were pretty critical of various aspects of what was happening. Are you more at peace tonight?
Well, I'm more comfortable with the overall strategy. There was a choice between allowing this virus to essentially take hold with the healthy part of the population and trying to shield the more at-risk part of the population, the herd immunity approach, which we were really, as far as I could see, the only country in the world that was thinking down those lines. And I was worried about that. We're now following the suppression route, which I think is better. But if I have two concerns now, I think the first is that if we're going to be successful at suppressing the virus, we need to have a South Korean approach to testing. We need to be testing absolutely everyone who is a potential suspect in terms of having the virus so we can isolate them, treat them. We are a long way away from being able to do that, so we need a huge effort on that. And the second big concern I have is protecting doctors and nurses on the front line. There are clearly massive problems with that.
You were close to becoming Prime Minister yourself. Would you have handled things differently?
I think the government is doing the right thing now. I don't think it's right for me to try and second-guess what they should do, given that I'm not seeing all the scientific advice that they're seeing. There are countries that appear to have turned the tide, and they were taking a very different approach to us last week. Now, what we're being told is that we're taking the same approach, and I think that's very, very encouraging.
Jeremy Hunt, thank you very much indeed for talking to us.
Thank you, John.
And in his evidence to MPs earlier, the government's chief scientific advisor, Sir Patrick Vallance, said it would be sensible for people with coronavirus to take paracetamol instead of ibuprofen, after concerns that anti-inflammatory drugs could make the condition worse. In its updated advice, the NHS says that there is currently no strong evidence that ibuprofen can make the virus worse, but says until we have more information, take paracetamol to treat the symptoms unless your doctor has told you it is not suitable for you.
Well, across the UK, hospitals are desperately trying to increase capacity in their intensive care units to cope with patients requiring ventilation, the front line of the virus pandemic. Our Home Affairs correspondent Andy Davies is in Merthyr Tydfil tonight. And Andy, you've spent the day with staff at a hospital there, haven't you? Fill us in on that.
Well, Kathy, what you're about to see, I think, is a rare glimpse into what's actually going on behind the scenes in many intensive care units around the UK right now. And it involves a huge amount of work in a healthcare system which is being rapidly reshaped in the shadow of this virus. Prince Charles Hospital here is part of the Cwm Taf Morgannwg University Health Board, and their clinicians today will be only too aware that there has been a second confirmed coronavirus death in Wales over at a hospital in Swansea. They will have seen the Welsh Health Minister compelled to self-isolate after his son developed a cough. They will be only too aware also of all the modelling which has been suggesting that critical care units around the UK could be overwhelmed in the months to come. And they know it is only a matter of time before they are admitting some very sick patients here infected with coronavirus. This is how one intensive care unit around the UK is preparing amidst this escalating outbreak.
OK, I just wanted to clarify what we're doing with PPE equipment in the event of a patient with a cardiac arrest.
It is yet another coronavirus briefing in yet another operating theatre now being emptied for new intensive care beds.
This guidance is if you've got a suspected or a confirmed COVID case, which will be down on the CDU, the Clinical Decision Unit, and you're doing an aerosol generating procedure, you wear the full PPE regalia, so that includes the FP3 mask.
So you need to make sure you've got a nice tight seal on the bottom.
In another room, it's a briefing on coronavirus protective equipment.
to get that nice tight seal.
To the right of us here is the clinical decision unit.
This is Dave Jones, a consultant in intensive care medicine in Merthyr Tydfil. And where he now takes us, a journey many others infected by coronavirus will surely follow in the weeks and months ahead. So this is now your new intensive care unit?
Yeah.
Specifically for coronavirus?
Specifically for coronavirus cases, yeah.
The Prince Charles Hospital normally has just 8 critical care beds. They're rapidly creating 14 more.
So what we've had to do is convert, excuse me everybody, bringing up all the equipment to make this into an intensive care unit.
We're shown an operating theatre with no table, an anaesthetic machine turned extra ventilator. In the days since the Welsh Government cancelled all non-urgent operations, this whole day surgery wing is now being co-opted for coronavirus critical care, and they want to be ready for tomorrow.
When you've seen and heard the accounts coming out of hospitals' critical care units in Italy, you must be imagining that the same could happen here.
We are preparing ourselves for every eventuality. The bottom line that I'm telling to all the staff is that we need to be able to look back on this in 12 months' time and say that we've done our best with the resources available, with the knowledge we had at the time.
This is a critical care department, like so many others around the UK right now, mobilising at speed for what comes next. The sense of urgency clear from the sheer numbers of staff being deployed and trained up for units like this.
Have you assessed the area? Yeah. Yes.
Around 100 were being trained here today to take on critical care roles. Anaesthetists, scrub nurses and recovery staff are here advised on intubation skills for coronavirus patients. Others are briefed quietly in the corridor.
You're fulfilling a fundamental role right now.
Yeah. And, you know, it's our job at the end of the day. We come to look after patients, we still have to look after each other, and that's all we can do at the end of the day.
We're not going to train 4 or 5 people, but as it escalates, we go through anything.
How proud are you to be an NHS worker
Extremely proud.
At this time?
Extremely proud.
Are your family worried about the role you're going to be playing over the
next few
months?
Obviously, you know, but I just think that I came into the NHS to care for patients. That's my first and most foremost role, and that's what I'll be doing.
Just had confirmation from Echo in cardiology. We've got 24-hour Echo service for our patients.
Here, gratitude for insights shared by counterparts in China and Italy is laced with an acknowledgement of the enormity of the tasks and hugely difficult decisions ahead.
The preparations isn't just shifting the ventilators from downstairs to upstairs. Part of the preparations is going to be the psychological preparation for what is to come, because we don't want the staff, I don't want my colleagues to be thrown in the deep end of making these decisions alone.
And so, like counterparts elsewhere in the UK, in China, in France, in Italy, they step forward, the healthcare workers upon whom so much now depends, to deal with a public health emergency, the like of which none has seen before.